Namaste everyone, I am NEHA GUPTA, student of MBBS first year. Today we are going to study about lungs. Introduction of lungs. So it has 10 bronchopulmonary segments. The right and left are separated by the mediastinum. 700 gram is the weight of the right lung and the left lung weighs about 600 to 650 gram. Some of the features of lungs are, it is conical in shape, its apex is 2.5 centimeter above clavicle. The base rests on the diaphragm. It has two surfaces, costal and mediastinal, and three borders, anterior, posterior and inferior. In right lung, there are three lobes and two fissures, oblique and horizontal. This is the oblique and this one horizontal, dividing the right lung into three lobes. In the left lung, there is one fissure, that is the oblique one, which divides the left lung into the two lobes. And one of the characteristic feature of the left lung is lingula, which is tongue-shaped projection which is below the cardiac notch. Root of the lung is a short broad pedicle which connects the medial surface of lung to the mediastinum, and hilum lies at this place. The contents are, in the right lung, there are two bronchi, epartial and hypartial bronchi. In the left lung, there is only one bronchi called the principal bronchus. One pulmonary artery in both right and left lung. Two pulmonary veins carrying the oxygenated blood in both right and left lung. The contents of root of lung are bronchial veins, anterior and posterior pulmonary plexus of nerves, lymphatics of lung, bronchopulmonary lymph node and areolar tissue. Talking about venous drainage, then left bronchial vein drain into hemiazygous vein and right bronchial vein drain into azygous vein. Lymphatic drainage are of two sets, superficial and deep. Superficial vessels drain the peripheral lung tissue and the deep lymphatics drain the bronchial tree, pulmonary vessels, connective tissue. And the superficial vessel has numerous valves while deep lymphatic vessels has no valves. About nerve supply, parasympathetic is through the vagus nerve, and these parasympathetic fibers are motor to the bronchial muscle which causes bronchospasm, secretomotor to the mucus gland of the bronchial tree, and sensory to the stretch reflex or cuff reflex. Sympathetic is from the 2nd to 5th sympathetic ganglia, which are inhibitory to the smooth muscles and the glands of the bronchial tree. Now we will be studying about bronchial tree. It starts from the trachea, which further divides into the right and the left bronchus. Right principal bronchus is 2.5 centimeter long. It is shorter and wider, and the left one is 5 centimeter long. It's narrow and more oblique. The left principal bronchus makes the 45-degree angle, while the right one makes 25-degree angle. Now each principal bronchus enters the hilum and it further divides into secondary lobar bronchi, one for each lobe. Therefore in the right it has 3 lobar bronchi and in the left it has 2 lobar bronchi. Now the secondary lobar bronchi divides into the tertiary or the segmental bronchi, which are 10 in each case. Here is a diagram of bronchial tree. Bronchopulmonary segment. So these are the well-defined anatomical segments aerated by tertiary or segmental bronchus, which are pyramidal in shape, and each one has their own arterial supply, but the venous drainage is shared by the adjacent bronchopulmonary segment. There are 10 bronchopulmonary segments in each lung. So the bronchopulmonary segments of the right lung are, since it has 3 lobes, right upper lobe, middle lobe and lower lobe. Upper lobe has 3. The right upper lobe has apical, anterior and posterior bronchopulmonary segment. The middle lobe divided into medial and lateral, and the basal or the right lower lobe has apical, posterior, lateral, anterior, and one more is there, which is medial basal segment, which is not visible from the anterior view. Talking about the left lung, so it has upper lobe and lower lobe. Upper lobe divided into apical, anterior and posterior, and further two more divisions are there, superior lingular and inferior lingular, while the lower lobe has apical, posterior, lateral, anterior, and again the basal medial segment is not visible from the anterior side,